So what we're going to do now is the TL junction manipulation. What I can do is bring him into this extension, ipsilateral side bending walk. When I bring him into the extension, extend up to the segment. This ipsilateral lock, this foot's on this corner of the table, and you see I can create side bending to that level. Solid. I'm going to do the ipsilateral extension lock. It just closes things up really well for when you're trying to focus it at a segment. So then I have hand above the head to give ipsilateral side bending. And then put your hand on the back of my, good. So I just have him grabbing behind my shoulder blade a little bit so then I can get to that level. Good. So we have him set up. I take this leg and bring it here so that I can roll him towards me and see how I have control. I have control of him, he doesn't have control of me, and there's no fear of falling off the table. I work my way to the segment that I find is restricted, which I would have found through my PIVMs. I will have stress tested, I would know that the reflexes were fine, and I would have permission from the patient saying, I'm going to do a quick push, there may be a pop or not, is that okay with you? So you get verbal consent, do your stress tests, the only thing left is a pre-manipulative hold. What I do prior to that is, with the patient in this position, I want to make sure I'm at the end feel, so I do my neuromuscular re-education beforehand. Go ahead and push down into me, and push back into me. And relax. We're going to do that after the manipulation, whether we have a pop or not, and then we're going to reassess your range of motion in standing. Go ahead and push down into me, and push back into me. Good, relax. Okay, so this is the area where I think you're tight. I put my sternum over the area where I think is tight. We'll have you take a breath in and out. Pre-manip hold. Push. Made a little cavitation there, but it wasn't like crunch, pop, whatever. That's fine. Even if there wasn't a cavitation, that would be okay. Now the work begins. Go ahead and push down into me and push back into me. And relax. And one more time, push down into me and back into me. Good. Now sit on up for me. So that's the manipulation. Then what you do is you're like, okay, let's recheck the rotation, which I checked it over there. Sorry, I didn't, but he'll be able to tell you whether that's, so that's moving better, and also into this combined motion. That's definitely better. We should have checked it beforehand so we could get it on film. So now you're just taking my word for it. But go ahead and stand on up. Now, functionally, what is this? Go ahead and step forward with this leg. Yep. Arm swing. Arm swing with gait, arm swing with running. So if you're restricted in the TL junction, you're using that mobility every day, and if you're restricted here, you're going to borrow range down from here. So you could do bird dogs till the cows come home, and it's not going to make a hill of beans a difference. What's this? Multifidus lift test. What's this? Stabilization and neuromuscular re-education. You manipulated part of a pattern on a chain to help this person walk better or run better so that they're aware of it. And we're going to show a test later on called the Portland test, which is done in almost the same position, which will fit in nicely. So what I want to do is practice looking for restrictions up at the TL junction, doing the neuro re-ed and manipulating. But remember, you're not always going to get an audible, but at the end of the day, the patient should feel an improvement in rotation, which will help with arm swinging gait, golf swings, any other kind, pickleball, anything like that, that it really helps people out functionally. You need to attach your manual therapy to function, or you're not going to have as effective a program or as much buy-in with your patients.